This week, the U.S. Senate hauled in a bunch of CEOs and top executives from some of the biggest drug companies here in the United States because they wanted answers about why we here in the United States are paying these astronomical markup prices for prescription drugs compared to literally everywhere else in the rest of the world. And the drug makers gave us the same tired and false responses saying, oh, well, you were saving lives and the R&D is so expensive and we get high profits because that lets us make more drugs and save more lives. We're good people. We're good people, they're telling us. And we got to go out there and save lives because you guys aren't. Who else is going to do it? We've got to do this. Yeah, as expected, literally no one in that hearing on the Senate side was having it. But the Democrats were far more outspoken than the Republicans were. The Democrats were pissed off, and rightfully so, because they understand that a majority of people in this country are struggling to pay their bills. A majority of people in this country are very angry about the high cost of prescription drugs. And Ron Wyden, Democrat, Finance Committee's top Democrat, said the following. He said, drug makers behave as if patients and taxpayers are unlocked ATMs full of cash to be extracted, and their shareholders are the customers they value above all else. And Wyden is 100% correct in his analysis there. You see, as AOC actually pointed out recently, taxpayers are funding the majority of Big Pharma's research and development. That's us. We're already paying for those drugs to be developed. So for these drug makers from the companies of AbbVie, AstraZeneca, Sanofi, Pfizer, Merck, Johnson & Johnson, and Bristol Myers Squibb, all executives were there, they're telling us that, oh, we charge so much because of R&D. That's a lie. We, the U.S. taxpayers, have already paid for your research and development, at least 75% of it. And yet you're charging us for some drugs over 200,000% markups. So you're literally making us pay for your drugs twice. And you get to keep all the profits. We don't get any of the socialized profits, even though we paid for the research. And perhaps that's one proposal that we need to start making. We need to socialize drug industry profits. You want to charge $60,000 a year for a drug like Humira, which is one single drug from AbbVie, made $20 billion globally last year alone just on that one drug, cost a U.S. citizen $60,000 a year for a full supply of it. You want to charge that? Go ahead. But we're going to keep 50,000 of those profits, and we're going to put that towards Medicare for all. We're already paying for the R&D. We own these drugs, or at least we should. And I think that is the route we need to go. If we can't get these jerks to lower their prices, we'll just start confiscating the profits because we are the ones who paid for the R&D. Thanks for watching, everybody. And don't forget, if you like what you see here, like, comment, share, and subscribe to our channel. And now you can also become a member of Ring of Fire and get exclusive early access to certain Ring of Fire videos all throughout the week. Just click on the little join button right below the video.